Medical system in North Korea. Hello, I'm Philip. North Korea has always been proud to talk about its free medical system. How is the medical situation in North Korea? Suppose, for example, you have a broken arm. You should go to the hospital and get an X-ray. However, you cannot get an X-ray right away because it lacks electricity. You may have to wait 1 or 2 weeks for the hospital to turn on the electricity. North Korea lacks an anesthetic. That's why most people don't use anesthetic to sew up their skin, pull out their teeth, and perform an appendectomy. To receive treatment at a hospital, individuals must buy and take the medicine they need. They must buy all medical tools and ingredients, such as injections, IVs, disinfectants, etc. Of course, it's not the medical profession that sells this stuff. When hospitalized, the caregiver must carry blankets, cooking utensils, and heating firewood for the patient. They make IVs by washing beer bottles. They make glucose from sugar and starch powder in hospitals. They boil the injection needles in water and continue to reuse them. North Korean doctors sell externally funded drugs such as the United Nations to the market for their living expenses. The hospital also washes and recycles bandages and cotton pads. There are few ambulances. Even if there is no gas. It is common for individuals to have muscle and intravenous injections at home. There is a separate hospital where only the top officials go. A high-ranking official needs Kim Jong-un's signature to take a picture of the MRI. In North Korea, infectious diseases such as cholera, typhoid, malaria, measles are frequent. For cholera patients, boiling water and continuing to feed them with salt are all treatments. They feed patients with typhoid fever with water boiled with a particular herb. They feed people with water boiled with rice straw to remove parasites. It is the reality of free medical care that North Korea boasts. One more thing. If you do a blood type test in North Korea, it could be wrong. Good luck.